PCOS stands for Polycystic Ovary Syndrome. Recently, there has been a name change to PMOS, which stands for Polyendocrine Metabolic Ovary Syndrome. I am Dr. Vyjayanthi. I am the Director and Consultant Fertility Specialist at Mother To Be Fertility, Hyderabad. Why the name change? PCOS implies that there are cysts on the ovaries. And secondly, PCOS also has got a lot of stigma attached to it, as the focus is mainly on reproductive health, and many women are stigmatized when they are diagnosed with PCOS. PMOS stands for Polyendocrine Metabolic Ovary Syndrome. This actually reflects the broader nature of the condition, in that the metabolic and endocrine aspects of the condition are also given importance, and it is not just a reproductive health disorder. This name change was actually requested by the women themselves. The women groups all over the world came over and suggested that a name change is indeed needed to move from, say, PCOS, which reflects only the reproductive part of the problem, to PMOS, which reflects the entire broader nature of the condition. Why women with PCOS find it difficult to get pregnant? Now that we have seen why the name change was requested and has happened, we will now move on to see why women with PCOS find it difficult to get pregnant. When women have regular cycles, they are ovulating regularly, and they have a chance of pregnancy with every cycle. However, women with PCOS have irregular cycles. They are not ovulating regularly, and hence they find it challenging to get pregnant. However, it is a myth that women with PCOS can't get pregnant. The fact is that most women with PCOS will be able to achieve a pregnancy with medical help. Now that we have seen why women with PCOS find it difficult to get pregnant, we'll now move on to see what are the treatment options available for these women to achieve a pregnancy. A significant proportion of women with PCOS are overweight or obese. In these women, the first step in the treatment is to lose weight. This is achieved by a combination of healthy diet and regular exercise. So how much of weight loss are we looking at to achieve before we can start specific fertility treatment? Say a woman is 70 kilos, we are looking at a weight loss of only 5 to 7 kgs, which is easily achievable by a combination of diet and exercise. So once this weight loss is achieved, what happens is the insulin sensitivity improves, and these women become more responsive to the further medications which we are going to give to induce follicular growth and ovulation. Now, once weight loss is achieved, we move on to the next step, which is medically called ovulation induction. Here we give tablets, particularly a tablet called Letrozole, from day 2 of the cycle for 5 days, which facilitates the follicular sac-containing eggs, follicular growth, and then ovulation. We monitor this treatment by regular scans to ensure that the response with the medication is happening and there is no over response and there are no complications. So one cycle of ovulation induction gives a chance of success close to 20%. So some women might need more than one cycle of ovulation induction to achieve a pregnancy. In general, we usually give around 4 to 6 cycles of ovulation induction, and if women are not successful in achieving a pregnancy with ovulation induction, then we move on to the second step, which is called IUI. I always tell my patients, say if 10 women with PCOS come to me, about 5 or 6 women are able to achieve pregnancy just with these tablets, which is ovulation induction. The rest 4 need the second and the third step in the treatment. The next step is intrauterine insemination, or IUI. Here, apart from giving tablets to facilitate egg growth, at the time of ovulation, we also get the husband's sperm, prepare the good sperm, and then put it inside the uterus with a small tube. This process is called IUI. So this is the second step, which again helps 2 out of the 10 women conceive. The last and the final step is IVF. So not every woman with PCOS need IVF. This is the final step. By using a stepwise approach, we are able to help most of these women who have PCOS or PMOS achieve a pregnancy. So to conclude, if you have been diagnosed with PCOS, there is nothing to worry about. With the medications we have now and advanced treatments, we are able to help most of these women achieve a pregnancy.